Welcome to the ACSD monthly webinar for October 2nd. This is Nancy, and from the STS, we have Carol Crone, Leanne Jones, Paul Meehan, Banu Yati, Emily Conrad, and Melinda Offer. I believe that's all of us on today. And we're going to go ahead and get started with our webinar. So for today's agenda, we have a few STS updates. Paul and Banu are going to talk to us about STS database platform access request process. And then Melinda has some education. We're picking up where we left off last time with previous cardiovascular interventions. So update-wise, the October training manual has been posted. And then I'm going to go over some important dates and talk a little bit about AQO Hot Topics. So today is October 2nd, and this is the monthly webinar. Friday, October the 4th, Harvest 3 closes. This is OR dates through June 30th of this year. Opt-out date is October the 8th. Then on October the 16th, we'll be having our quality improvement webinar. We're going to launch our blood usage project. Then on October 24th, we have our AQO ACSD Hot Topics webinar. More to come on that. And then November 6th will be our next monthly webinar. And again, Harvest 3 closes Friday with an opt-out date of October the 8th. And then coming up directly behind that is Harvest 4 in November. That harvest closes November 22nd with an opt-out date of November 26th. AQO 2024 is in the books. It was a blast. We really enjoyed seeing everyone who was able to attend in person. Thank you to all of our amazing speakers and all of our attendees. It was a fabulous time in Nashville. The AQO virtual meeting platform is open. If you signed up for the virtual platform, that is open. The on-demand sessions and the live session recordings are now available. Don't forget to evaluate the sessions and claim your continuing education credit. Just remember that you need to watch all of the on-demand and live content and evaluate all of the presentations on the platform. And the deadline for claiming your credit is Friday, December 13th. Our AQO Hot Topics webinar is currently scheduled for Thursday, October the 24th. This will be a half-day webinar for those who have signed up for the virtual platform or attended the live meeting in Nashville. If you would like to attend the AQO Hot Topics webinar and you haven't and you didn't sign up for the virtual platform, don't worry. The registration is open and you may purchase a virtual pass. With the virtual pass, you will have access to all the on-demand content and posters and also the archived live sessions. And then the pricing is listed down here at the bottom. STS members, the price is $400, and for non-members, it's $500. AQO 2025, our meetings team has started planning location for that. We will be live in person and also virtual for 2025. More to come on that. We don't have a location yet, but we're thinking it may be Chicago or New Orleans. Those are all of my updates. I'm going to turn it over to Banu and Paul for the STS database platform access request process.
Hi, thanks, Nancy. Hi, everyone, and thank you for joining us today. Paul and I will cover the new MPI validation functionality today, what it is, what to do when you receive error messages, and how to add context to your PID to eliminate those errors. We'll also talk about how to best utilize the STS database help desk support so we can all have a more streamlined, fast, and easy way to respond to your inquiries. So as many of you know, back in May 2024, there's been a new functionality that's been released on the database platform. It's called the NPI validation functionality, and it impacts participants using a third-party software vendor. And this feature ensures that only the cases of surgeons or anesthesiologists on your contact list are accepted into the database. So if you upload a file that includes cases for a surgeon not on your contact list, the records will trigger a critical error and the cases will not be accepted into the data warehouse. So, and in addition to this, any records with an incorrect MPI number will also trigger the same error message, rejecting your cases to upload. So you need to add all your surgeons or anesthesiologists to your respective PIDs if you're uploading cases for them, including your locum surgeons. Next slide, please. So what happens if a surgeon is not added to your PID and you have uploaded cases for him to the platform? Well, you will get a critical error message, just like the one you see here. This is an example of how you will see that critical error in your DQR, your data quality report. If you see a critical error message after your upload, once you click on the critical error, which is the red part of the pie, you can see the details of the said error list underneath the graph, and then you see any messages that says anesthesiologist or surgeon invalid MPI error, just like the one here. That means those surgeons and or anesthesiologists need to be added to your PID so you can successfully upload their records. Next slide, please. So if you see a message that says, record XYZ is referencing an invalid surgeon or an anesthesiologist MPI, that means your record has been skipped during upload. That means it's been rejected. It hasn't been uploaded. So the first thing you need to do is opening your contact list report on the IQVIA platform, compare surgeons in your upload data or anesthesiologist in your upload data with the contacts in the contact list report. If they're not on your report, then you need to submit a participant contact form and a signed Schedule A or a Schedule B form to get them added to your PID. If all surgeons and anesthesiologists in your data are on the contact list report, then you need to compare the NPI numbers in your data with the National Registry and then update your data with the correct values before you re-upload your cases. Next slide, please. First of all, please note that not everyone has access to the contact list report. Only primary and backup contacts can see and access this list through the database platform. And if you're a primary or backup contact, once you log into the platform, as you can see on the left side here, you can click on the operational reports section. And then right underneath your list of reports, you'll be able to see and access your contact list report at the bottom of the screen, as you can see here. Next slide, please. So, once you get into the contact list report, this is how you will actually see the list of names and corresponding roles of the individuals on your list. You will obviously have contact names listed underneath. We're using a test site, so there are no names here, but you should have names and the corresponding roles right next to them when you open up the contact list report. Next slide, please. So for those of you who've never done this before, I'd like to start off by reviewing how you can add context to your contact list report. Let's say that there's a new surgeon you'd like to add to your PID, or there's a surgeon or an anesthesiologist or a contact you'd like to deactivate or add. In all of these cases, the participant contact form is the correct platform to initiate all of these change requests. Participant contact form, in short, is called a PCF. A PCF is an online form that you can fill out and submit, and it allows STS to make those changes that you request. It's actually the fastest and easiest way to make those changes. And there are multiple ways you can access the PCF form. You can go to the STS website, put participant contact form on the search bar, and then hit search and locate this form, or you can just go to the website again, under the data manager section, which I'm sure all of you are very familiar with. You can scroll down and click on the participant contact form right under essential forms and resources. It's, as you can see on the right-hand side, it's a pretty basic one-page document where we ask for the full name, MPI number, email address, etc. of the contact you're adding to your PID. And once you fill out the form, you click submit, and then you're done. It allows you to send multiple requests within one form. So if you're adding, let's say, a surgeon, you can put it there, as well as a deactivation of a different contact and addition of another contact on one form, as long as it's only for one PID. A separate form is needed, or you need to submit a separate form for each PID. Next slide, please. So we do receive questions around which database participant role you should assign to a new contact whom you're adding to your PID, and there's a document for that. It's called the Participant Roles and Descriptions. So please review that for a detailed explanation on each role before submitting the PCF form to decide on the level of access you'd like to assign to the participant. And that document is also located under within the data manager section under essential forms and resources. Next slide, please. Excuse me, which slide are we on? Slide 9, right? Okay. So please note that we cannot add a surgeon or an anesthesiologist to your PID unless we do have assigned and filled out Schedule A or a Schedule B form for a surgeon or an anesthesiologist. Schedule A forms are for surgeons and Schedule B forms are for anesthesiologists. And this form basically gives us the permission to work with that surgeon's data. So you can understand why we're not able to add a surgeon or an anesthesiologist without a Schedule A or a Schedule B form available when you're submitting the PCF form. Next slide, please. You can see on this slide the Schedule A and the Schedule B forms. They're not really very different from each other, but we do have separate forms for surgeons and anesthesiologists. And again, you can access these forms through the SDS website, as mentioned on the previous slide, under essential forms and resources. So all of these documents are actually, housed under essential forms and resources, just for your convenience. But if for some reason you're having a hard time finding them, reach out to us and we'll be more than happy to, direct you to the right location for it. Next slide, please. This one is an important information to know because only primary and backup contacts should be submitting a participant contact form. And if we receive a form submitted by any other contact, we'll have to loop in either the primary or the backup contact and request their approval before we can process this form, the PCF form, which will definitely delay the process. So we encourage all of you to have your primary or backup contacts submit the online forms. Next slide, please. I'll share a couple of more, couple of important information before I turn it over to Paul for a more exciting topic. But as I mentioned in my previous slide, confirmation of credential is done before we can process any PCFs. It is important that they are sent or submitted by your primary or backup contacts. Otherwise, it just takes longer to get their approval and then to process everything. The processing time is usually 5 to 7 business days, but sometimes we get tens and, it's hard to believe, but hundreds of them on a day. And it takes a little bit longer because of, all the increased activity that we have. Our team does so many different things all in a given day that it might take slightly longer than 5-7 business days on certain times of the year. But it's usually 5 to 7 business days. And if you're going to inquire about a PCF, please wait till, for 7 days before reaching out to ask the status of your PCF. And we do also receive requests via email, which we always reply back, encouraging them to submit a PCF form. So requests via email will only delay the process. Again, we highly encourage everyone to send a PCF form along with the needed mandatory documentation for surgeons and anesthesiologists. So, everything is done very streamlined, very fast, and, you will see your surgeons on your contact list as soon as possible. With that, I'll turn it over to Paul.
All right, thank you, Benu. Hi, everybody. Paul Meehan, and have been helping out with help desk since I started working with the STS a little bit more than a year ago. So I'm a little surprised here. Banu thinks this is the exciting topic, but I thought I'd go through given some details of how the help desk works in the background, kind of give you a better idea of how to ask your questions and who to ask at the right times. So
I just want to, I'm sorry, Paul, for interrupting.
Sure,
I
no
just want
problem.
to say Paul's been with STS much longer than 1 year, but he's officially been
Yes,
working with
that's
STS
right.
for a little over 1 year.
Yes, yeah.
And-
So I've been helping with help desk for just about a year. So
And that pick, Paul, is exactly how I see you at answering, addressing, doing help desk. I'm sorry.
okay.
Made
All
me
right,
giggle.
next slide, please. All right, so the main help desk, where probably 95% of your questions should be going, is the STSDB_help desk at sts.org. That is the help desk. Several of us are working on, monitoring that help desk. If we don't have the direct answers, we know who does, and we can pull those people in and get your questions answered as quickly as possible. So this is the help desk that you would use for problems with your login. Either you need you forgot your user ID or your password, you need a password reset. You're getting logged in, but you're not seeing the report you think you should be seeing. You think your accesses needs to be adjusted. Mainly the data submissions. If you're using a vendor software and you're submitting your data, and you're having problems getting the files in, like the NPI issues that Banu was talking about. Any kind of issues that come up like that you don't understand, this is the help desk you want to send that to. Also, direct data entry. If you have questions, about how to do that, we can get you the information on how to use those forms and stuff like that. Any questions with your reports once you get your analysis reports? Now, actually, it's whether it's your data quality reports, your harvest summary reports, missing variable reports, the risk adjusted reports, all of them. Any sort of questions you have on those, you send them to this help desk. If you have questions about your vendors, you can send that to this help desk too. Now, that's not to say, how do you use your vendor software? How do I enter this into my vendor software? What reports are available in my vendor software? That's your vendor. You got to go to those. You got to go to them to get help with that. But if your vendor is telling you something and it doesn't sound right, or the software is not working the way you think that it should be working, that you can send to us, and we can give you the official answer on how your vendor should be functioning. Your red cap questions, if you're filling out those forms, any questions with that, you can send that to us. So basically, if you're not sure who to send the question to, send it to this help desk, because we're kind of the catch-all, and we can handle most of the questions. And as I said, anything that we can't answer, we're happy to send it off to the correct help desk, or to the other staff that can help get the answers to your questions. Next slide, please. All right, 2 other help desks that I do want to talk about that you can work with directly is the database help desk. So that's STSDB at sts.org. So without the _ help desk. This is the help desk that you use for official business. Okay, so signing your contracts, if you want to start including anesthesia data and you want to get signed up for that, if you have any billing questions, anything involving money, that's got to go to the official business database help desk. And if you work directly with them, they can get the answers to that to you faster than we can. The other help desk is the frequently asked questions. This is for the clinical questions. Now you can send emails directly to here, but there's also a form on the same website, same place where you got the participant contact updates. In there, there's a place where you can submit your frequently asked questions and submit it that way, or you can email it to this help desk. So this is questions like, how do I code a patient that had XYZ? Does it fall into this category or that category? Or if you have questions about the data specs or the training manuals, the definition isn't quite giving you the answer that you need and you need a little bit more detail, that's a frequently asked question. So anything that's clinical would go to that. So always keep in mind, I'm just a programmer. They're asking me about, how a patient with such and such a disease and such a device, how should that be recorded? I have no idea. You're better off at FAQ for that one. All right. Thank you. Okay, so how do you want to give you some tips on effective communication with the help desk, whichever help desk you're going to. All of these tips kind of apply. Main thing is being clear, concise, and to the point. We go through lots of emails and helping people with their emails. If you give us all of the information up front, and keep it short enough that we can get through it quickly. We don't need big long paragraphs. Anytime you see a paragraph, you're probably giving us too much information. But do include some of the the key information, starting with your participant ID. If your question is about the you're having trouble with the surgeon NPI, or the records are being rejected because of a surgeon's NPI, give us the surgeon's name and his NPI. That definitely helps a lot. So making sure that you include all of that information saves us from having to ask you for that information. And, we're trying to do this as quickly as possible. And once, if I can answer your question by just looking at your original email and get the information back to you, then everybody's happier. If I have to go back and forth with you, we're happy to do it, but it's going to take longer before you get your final answer, because I'm going to have to send you an email. You're going to have to send me another email. I'm going to have to get back to it and stuff like that. So, trying to provide as much upfront as possible is always helpful. Also, try to be careful of the use of your subject line. Subject lines, you want to think 10 words or less. It's mainly what we use this for is when we have several packages that we use to track all of the questions that you send in, and seeing the subject line helps us know who should be handling that question. So, if it's a problem with a vendor, that's usually going to be me. If it's a problem with the surgeon NPI issues and stuff like that, that's going to be Banu. And there's other people. So if brief description of what the issue is, just kind of always think of it as a title, just a couple of words. That helps us a lot to be able to keep these things organized. And then also, and then in the body of your message, that's where you give all of your details. And as I said, provide all the details you can, but try to be concise. Always helps. And a big thing that always helps a lot is including a screenshot. If you're getting an error message or you're seeing something on the form and it doesn't look right, when you send us a picture, it really does. It really is worth 1,000 words. I can see things in the background that tells me exactly what report you're talking about. If I can see the picture, the text of the error message that you're getting, A lot of times there's codes in there that will tell me things that will help me answer your question and understand what's happening and things like that. So like things that you wouldn't think would be helpful, a lot of times are. So if you could do a screenshot and attach it to your email, that's always helpful. And I wanted to do a quick demo here of how to do this. So I'm going to take over the screen here in a second. I want to show how to do a screenshot because we get a lot of people send us photographs of their laptops and we, it's, in one sense that kind of works, but that when we zoom in on those, the text tends to get blurry and it's a little bit harder to read. So I thought I'd take a second here and kind of show, and I'm assuming that you're using a Windows platform. And here we go, share. Sure. Okay. Yeah, so I'm assuming that you're using a Windows platform, and if you're not, you're gonna have to talk to somebody else because I don't use the Apple products and stuff. So you'd have to talk to somebody else. But suppose you were loading in, you were uploading a data file, you got to your tile that shows the results of uploading it. You're getting a green check mark here, but you have a red X here. You're not really sure what's going on with this. You're trying to figure out what's going, this is part of the information that helps us understand what you're talking about. If you are having trouble with a file that you've uploaded, this case forms upload ID right here, this tells us a world of information. Okay, because you may have uploaded 20 files and I don't know which one you're talking about. Having that sort of information helps, having these counts help and stuff like that. And can everybody see my cursor moving as I write this, or is that invisible?
Yeah, we can see
you
it.
do see it. Okay, good. Okay, so what you want to do is you want to hit, and we'll come back to this to the screen so I can show you the button, but you want to, it's a 3-key process. So you hit the Windows key, the Shift key, and the S key, S for Sam. And you hit the 3 of them at the same time. Now, obviously you can't see that, but I'm going to go ahead and do that right now. And you'll notice that my screen goes kind of gray. Okay. And I also get this little plus sign here. Okay. So now you're seeing your screen and you're going to use the plus sign to do your screen capture. And all you want to do is move the cursor to the top left section of what you want to take the snapshot of. So all I need is this tile here. And so I move the cursor up there, and then you click and hold the left mouse key and then drag it down to the bottom right and let it go. And now the gray goes away. And what that does is that puts it into your clipboard. So now when you go to your email message that you're writing and sending to help desk with your brief subject line, you can just do a paste, do a right click and paste, and it gives me that exact information.
Let's go through it again real slow.
Okay. Right here, let me take this out and start again. All right. And then I got to get rid of some of these things here.
Everybody try along with Paul. It's the what
It's like romper room, play with Paul.
play with Paul, everybody. Play what is it? Who is that man that does the very beautiful paintings? It's like learn to
Bob Ross,
with
yeah.
Bob. Paint with Bob. Learn screenshots with Paul. Okay.
All right, so you hit 3 keys at the same time. The window key, the shift key, and the S. You press all 3 at the same time, and your screen will go gray.
Oh,
And
yeah,
you'll
look
get
at
this,
that.
and your cursor will have this little plus sign. Okay. And then you just go, you start at the upper left of what you want to take the shot of. Click and hold and drag it down to the bottom right. And you'll see that highlight. And once you let go, it is now taken a screenshot of that and stuck it into your clipboard. So now when you go to your email message, you can say, here is my screenshot. And then you can just hit Control V if you're a Control C, Control V kind of person, or do a right click and do a paste. And that gives you exactly what you copied out. And you can put multiple of these, you could do the next one. Take, if you have screenshots of, here's my tile. Once I get down into my report, here's a picture of the error message that I'm getting and stuff like that. Adding multiple screenshots, that's beautiful. We love pictures. So
we really do love pictures.
yeah, it makes things a whole lot more clear.
And
stuff.
oftentimes when Paul or Banu get a question and then they pass it on, this is Carol, to Nancy or myself, I often, probably quite a few times, reach back out to them and say, can we please get a screenshot? Or I reach back out to the site and ask for a screenshot. It just tells us so much information about what report you're looking at, what exactly, when we're reading the email, it just helps connect the question to what you're seeing on the screen. So it's very helpful to us if those are included. Please.
Yeah, so actually this is actually a pretty, this is a test site that I'm using, so this isn't anything real. But like seeing a picture like this, you're trying to find out why are you getting an X. I'm looking at this and I'm seeing that the file name's not following the correct format. So that's telling me a whole lot of information. So, pictures can tell us things that you're not noticing, so that they definitely help a lot. So, and we can go back to could you pull up the presentation again? There we go. And I just wanted to point out that the Windows key that I was talking about looks like this over here. Okay. Okay, nope, go back one. Yeah, I still have more to cover on that one. So
Trying.
sorry, well, somebody had a question?
No, I was just going to add something, but after you, Paul.
Okay. Okay, so sending us the email, brief and concise, give us screenshots. So those are things you should do. Here are some things you should not do. Do not send messages to multiple help desks. Don't send the same message to several people. You think that that's helping you to get your questions answered faster? It's not. It's really bogging us down. When multiple people are poking at the same problem, we cross over each other and we slow each other down. And then if you send it to this help desk and other individuals, like some of you have gotten a hold of individual people's emails and you send it to help desk and to the individual, or to all of the help desks. And, when those people get that same email, they then turn around and forward it to the correct help desk. But what that's doing is just creating another email and another ticket that needs to be addressed. And so when, we end up, a lot of times we'll have multiple tickets that we have to close out for the same question from the same person. That's an easy question to answer, but now it's going to take me 3 times as long because I have all this overhead that I have to clean up, make sure I'm answering the question, and nobody else has already answered the question, and all that stuff. So that's
or even assuming that someone else answered the question,
right,
because it's addressed to, we know that multiple people received it.
right.
You assuming, or somebody assuming that even myself, that the question was answered, and then 2 weeks later we get another email, hey, did you ever respond to this question?
Yeah.
And it really
no,
causes
yeah.
I mean,
Yeah.
if you CC us, I think if you CC, if you're seeing me and Nancy on questions that you're sending to the help desk, I think that's totally fine, but don't send us multiple emails, because it really does cause it causes a lot of confusion, and we want to make sure we're answering your question, not accidentally assuming somebody else has answered it or something like that. So
Yeah, and I would say only CC Carol or anybody else on the message if they're like directly, you know, they've been helping you with something and they told you to get in touch with help desk or something like that. You know, if they're already in on the conversation, I would not start a new question by CC and Carol or something like that. If it's a question that help desk will be answering, we'll answer it. You
Yeah.
don't, you know, we'll tell Carol about it if it's, you know, something that needs her attention, but you
Yeah,
know,
not only that, like we were going to involve those individuals who needs to be involved in that email thread if need be.
right.
So you can, but it's just gonna be too many emails for everyone.
Right.
Because we do involve them. That's why we're there for.
Yeah. You
Yeah.
know,
And,
so
and this is Melinda. I can second that, because quite often I'll get questions and the database operations been CC'd, the help desk has been CC'd, and it's
right.
like
They
I
just
don't
know
know
where to
know
send
where
the
to
questions
start
to.
and who
Right.
you know and who's gonna answer this question, because we all want to respond to your questions. So
Well, yeah, and sometimes there's multiple questions in the same email that require multiple people's responses. Right, like sometimes we might get a question about if or a case is or is not included in analysis, and then we might in that same email, oh, by the way, I have questions about billing, or I have questions about adding somebody on to my site. So we may need to include, even if you send it to the help desk, to Melinda's, to the FAQ mailbox, Melinda may need to send it over to somebody else to answer the other part of the
Yeah,
question.
and that actually that brings up a good point. Something that I wanted to bring up is, you know, a lot of people say, "Well, can't you call me? I can explain it much easier on the phone call." And so, you know, I understand that you know things are easier to say than put into writing, but a lot of times we do need additional people brought in, and I need to be able to just forward the information to them. So it really does need to be in writing. That's a lot of people asks for, you know, for us to call them back, and that really doesn't help us a lot. You know, we also like to keep a paper trail of all the questions that come in, so that if we get the same questions over and over again, we can refer back to them and see who's having that issue. You know, things like that. So like having it in writing is a big thing, but it also speeds things up, because then it's, if I need to pull Carol in, I could just shoot her, I could just forward the email to her and she has all the information right there. So.
Yes.
And then lastly here, I just want to point out, I know that out there, like in the IQVIA platform, there's links and instructions telling you, you know, email IQVIA help desk if you have problems. Don't email IQVIA help desk. Okay. Come to the STS help desk first. Okay. The only time you want to send an email to the IQVIA help desk is if they have sent you a message and they're trying to get some more information out of you. So you're just responding to their email. That's the only time you want to use the IQVIA help desk. Other than that, because we are, all of the help information that we can get, we're pulling more away from IQVIA handling those, and it's all being handled by STS at this point. And so lots of times they just get lost in the shuffle when they go to IQVIA. So do make sure that you do not use the IQVIA help desk unless you're just responding to their email. So there are sometimes, you know, you ask us a question, we don't have, excuse me, we don't have access to the production data, like something that you know, added to the database yesterday. I can't see that. So I have to forward that question onto our tier 2 team, and they can take a look at that, and they may send you a message, you know, in response to that saying, hey, you know, this is the issue. Can you, you know, give me this additional information or something? That's a case where you would reply back to IQVIA. Other than that, you really only want to talk with STS, because we're handling basically all of the other issues and questions. So. Okay, next slide, please.
Just want to quickly add something before we get on to the next slide if possible.
Mhm.
And you know, can we go back to the last slide?
One moment.
Sorry.
I clicked some sort of button that I shouldn't have.
Well, that's fine.
There we go.
Also, please do not send multiple emails for the same issue to the help desk on a given day.
Good point.
Because you know, it sometimes unfortunately allows us to work in silos. We assign certain messages to certain people, and without knowing, we might actually assign the same person's message to two different people, which, you know, takes valuable time away from other messages that we can tend to. And also there might be some missing or partial information in one email where the other email might have more information offered. So we just want to make sure that, you know, it's streamlined and we provide you with the most up-to-date information that we have, and it's fast and clear. So if you send one email on a given day, that'll be more helpful for everyone. And if you want to check on status, for some reason you did not hear back from us within 48 hours and you want to check on status, it'll be best if you can just forward the message, the original message that you used to send to us. So it's easier for us to track and see who actually handled the message, and so that we can respond to you, you know, in a more clear and concise way, if possible. That's very helpful also.
Yeah, good point, Benna. Thank you.
Thanks.
Okay, so here's just some examples of an ineffective email versus an effective email. And, you know, we sometimes get questions, you know, why does my report say I have 125 patients? That's nice. First off, who are you? What participant are you talking about? Which report are you talking about? Almost every report has a total, has number of patients. So I have no idea what this person's talking about. So like, you know, but we get these questions. And, you know, we all love our surgeons, but I could always tell when a surgeon's sending in a question, you know, can't log into the database. Okay, which database? Who are you? You know, stuff like that. So, you know, being brief is one thing, but we do need some additional information. So, you know, if you have, so the effective email on the right side is, you know, if you have a problem with something within a report, tell me the name of the report. Which report period are you looking into? You know, what type of procedures, what filters have you applied to get down to where you're seeing the issue? And then, you know, you know, the number of cases is showing up as 125. I think it should be 130. And then give me a screenshot of what you're seeing. That's beautiful. We can, you know, now I know exactly what you're talking about. I know who to ask to find out how this number is being calculated, and I can get the message off to them as quickly as possible, and we'll get an answer to you as quickly as possible. So that's the kind of detail that we're looking for. You know, really give us, how did you get down to the issue that you're seeing? And then what are you seeing that doesn't look like what you're expecting? That always helps a lot. So, all right, next slide. And so our response time, we really, you know, we ask you to give us at least 48 hours to answer your questions. I would say most of the questions get answered the day you send them in. You know, there are times where, you know, we've got too many of them, and, you know, it has to go on to the second day. You know, if you have some really big issue and there's something that, like, okay, you know, when you're asking, it doesn't look right to you, I take a look at it, doesn't look right to me either. So I need to start getting other people involved. I get, you know, other STS people, I get IQVIA people involved. The more people I get involved, it does kind of bog down getting an answer to you. And we try to keep keep you informed to say, you know, I'm looking into your problem. It's going to take me a little while or something like that if it starts going beyond 48 hours. But for the most part, I would say it's, you know, they usually get answered within 24 hours and stuff. We try to make sure by the end of the day we have all of our tickets addressed. So do be patient with us. And like I said, you know, if it goes, like Banu said, if it goes beyond 48 hours and you want to check on it, just forward the message again to us and just ask, you know, can you get a status update? That helps. We can reply to that. So, all right, next slide. That's it. That's all we got. So thank you all. And I don't know how you want to, Nancy, I don't know how you want to do questions and answers. Do you
I
have more to
think,
cover before we get there?
I think what we're going to do, Melinda had some education, but I think we're going to move that to our November webinar.
No.
And so we can go ahead and take questions.
I'm sorry, I talked too long.
No.
Yeah, you did, Paul.
Yeah, I know. That's
Just kidding.
I told you.
Just kidding.
It's not hard to get me to talk. It's hard to get me to shut up.
Oh, Lord. Just kidding.
We could go ahead and
That was a
actually,
great presentation. Thank
it
you.
was a great presentation.
Okay.
And we could go ahead and do Melinda's talk, but then there would be time for no questions. So in the interest of getting everyone's questions answered, we'll just go ahead with the questions, and Melinda will give her education next time. And it's all good. That was fabulous, Paul and Banu. So,
You're very welcome.
thanks. I noticed that questions were coming in and they were getting answered. So thank you for answering those or typing those in. Heather has her hand raised. Did you need to unmute, Heather? And then Holly.
Hey, are you able to hear me okay, Nancy?
Yeah, Heather. I hear.
Father, I had been actually getting help through email, but I just wasn't completely clear. I had actually sent in and updated all the surgeons and everything, but for the DQR representative, that's what I had a question on. I kind of have a weird situation here at UCD. We have an interim chief who is not doing adults, but he's our interim. So I changed him to my surgeon primary, but I'm not understanding who the DQR recipient should be. Can that be also him, and would that be best? Because he's not actually submitting data. You know, he's not actually one of the physicians submitting data. He's just our overall representative as interim.
I can answer that. So he's a physician, he's a surgeon, right?
He is not an adult cardiac surgeon.
Okay, then you can definitely add him as a DQR. He will have read-only access, but you can also utilize that document that I mentioned in one of the previous slides that actually outlines the roles that correspond with, the roles that we
They've
have.
already sent me all the information. I've gone back and forth on emails. She kind of gave me
Yeah.
the details. I've seen that. I guess I'm just
Okay.
still wasn't understanding, because the situation is a little different, if he should be the best representative for that, because I don't really have anybody else. I want him to have whatever access he wants. It doesn't really matter. He's interim chief.
Okay, then, if he's not submitting any records and it doesn't look like he's not uploading anything, a DQR recipient would be the best role for him. So you can add him.
Okay. And so he can be the surgeon representative as well as the DQR recipient.
Yes, but as the surgeon representative, if he's already the surgeon representative, he already has, access to all the reports and everything. So
Okay,
there's
but I don't need the person who's the current DQR to be that person. But I have to put somebody.
Yeah, that's something internal that you need to decide. But from our end, if he's already,
Can it just be? I just need to put somebody else. It can't be me, or just have it blank.
I don't think you have to have a DQR.
No,
yeah,
you do.
That's
DQR
what
is
I
not
needed to
required.
know.
It's not
Right.
a role that you have to have.
Right.
Perfect. I can clear that out then. Yeah.
Perfect. Thank you.
Wonderful. Thank you.
See how we all work together on these questions? Tap into each other's brain. That's what happens. That's
Right.
why.
Would you be? I can't
Yeah.
mute myself. Sorry about that.
No, we can get. I got you. Hold on.
Thanks, Carol.
You're welcome.
I think Holly had her hand raised, but I don't see that anymore. So Holly, if you need to chime in, let us know. First question, can you go over any changes to the star ratings and the analyzed cases, please? There are no changes to the star ratings. We do have 2 new proc IDs coming up, multi-valve and multi-valve plus cabbage.
Yeah, the only one I would add in is the multi-procedural, Nancy.
Right.
In Harvest 1, that would be a new star rating, but that's not until Harvest 1.
Oh, yeah, that's right.
Yeah.
Peter, we submitted an exceptional risk case in July. When should we expect to hear if the case was approved or not? The cases that were submitted for surgeries in July, August, and September are still being reviewed by the surgeon committee. Hopefully, you'll be receiving an answer in the next few weeks. Please review the harvest times. So harvest 3 was extended from August 27th. It was extended to October the 4th. And then harvest 4 is November 22nd. Let's see. In light of Hurricane Helene, will there be an extension of the harvest date? Carol,
No, I can take that one. There's no extension for the ACSD harvest. We've extended it a couple times now, and hopefully everybody has their data. And I think the original close date was sometime back in August or early September. I can't remember. Must have been mid-September.
August.
Oh yeah, I guess you're right, because it was June 30th, so it was probably mid to late August. And we've extended it now 2 times, once for a hurricane that occurred a few weeks prior to harvest close and the original harvest close, and then another time due to cyber attacks at some large health systems. So hopefully everybody's data was in and cleaned up before this occurred. Way back in August.
Thanks, Carol.
You're welcome.
What is the benefit of adding anesthesiology? So if you participate in the anesthesia module, you would need to have your anesthesiologist added on your participant form.
Yeah. The benefits of participating in the anesthesia section, I think, would be to get back some more granular details regarding the immediate pre, intra, and immediate post-op anesthesia care of the patient, mainly for quality improvement type projects. If you're monitoring different post-operative outcomes, that might be something that you choose to participate in to gain a better understanding of what's happening with anesthesia, to have it all tracked, and then work with your anesthesiologists in improving post-operative treatment of patients as well, immediate post-operative treatment of the patients.
All right, thank you.
Mm-hmm.
To all asking about the harvest deadline, yes, Justin chimed in. It was extended to October the 4th due to a different hurricane, not the one we just experienced. And then Cyrus, congratulations to Sherry. Sean has added some instructions for Mac users on how to get a screen clipping or a screenshot. If you want to go into the Q&A and look at those, if that pertains to you. And I'm not sure, Annette, your question, what format should it be? Not sure what that means.
I think she was asking about when Paul was talking about like the data file format, thing like that.
Oh,
Yeah. I think, but he was, I think in that example, I think the file was named incorrectly or something like that.
Yeah, and the file naming convention, and the format of the file is all handled by your vendor. You have no control over that. Your vendor should get it exactly right. So if something's wrong, we got to pull your vendor into the equation. So, yeah, basically the users should not have to worry about that at all.
Thanks, Paul.
Mhm.
Mary, this has been very helpful. Kelly, the Friday, October 11th deadline was confusing. Thank you for the update. Any update on frailty data collection? That is on hold right now. Carol, do you have anything to add about that?
Project are ready. I think we're meeting with them tomorrow to see how their project has rolled out, any issues that they may have seen, or how they overcame any of the obstacles or hurdles to be successful within that state. So we're meeting with them this week, and then we'll have more information for our surgeons to make a decision about how we're going to proceed forward with this.
Thanks. Q3 harvest previously dated earlier than October 4th. When was it pushed back? It was pushed back in August. Karen says, thank you. Even as a longtime STS participant, this was very helpful information. So thank you, Paul and Banu.
No trouble.
And we don't have a date for the Harvest 3-star ratings.
No, I think we're going to close, harvest closes October 4th. Opt-out is ends October 11th. So typically takes IQVIA a week or two to package up the data and get it sent over to the STS Analytics Center. So that puts us at October 25th or so, right around there. And then usually it's about 4 weeks. So I would expect that report to be out sometime late November or early December. A little bit later than this year, but that's just, we extended the harvest the first time. In August, we extended it to September, and that was a 2-week extension for a hurricane that had damage to the southern area. And then, or actually, I think it may have even been, I don't remember exactly where, but it was for a hurricane that occurred at the end of August, and then mid to end August. And then we extended it again in September. We extended it to October 4th. And that was due to a couple large hospital systems having cyber attacks, and we're trying to get as much data in as possible to keep the national benchmark, keep the numerator for the national benchmark as close to possible as we can for this harvest, since it's a star rating. So because of those 2 extensions, we should expect this harvest 3 report, which is our next star rating, to be available hopefully end of November, early December, the latest.
Where can we find the instructions to submit exceptional risk cases? So that those instructions are on the STS website. It's a web form. If you go for data managers and data manager resources, adult cardiac surgery, it's like in the middle of the page. And then there's a whole paragraph or 2 explaining the process and the criteria. And then there's a link to a web form that you can fill out. Andrea talked to Carol at AQO. She works for UT Southwestern in Dallas. They're looking for a data quality coordinator. And Andrea has her email in the Q&A box if anyone is interested in that. Specific information on the new STAR categories available. I would like to begin working on building the reports. So as Carol mentioned, the multi-procedural PROC ID will be a new STAR rating, and that is going to start with Harvest 1. There will be information coming on that. Anything else you want to add?
No, I would just say that we presented on it at AQO, and we'll have a presentation on it for the Hot Topics webinar. And I encourage all of you and of course we'll present on it additionally during these webinars. But it'll be me and Nancy presenting on the webinars, and Hot Topics AQO presentation. We'll have Dr. Bowdish present and be available for questions during that Hot Topics webinar. So if you haven't purchased AQO yet, or think that webinar, Hot Topics webinar, will be helpful to you, and it's just one of the many topics we'll cover, please make sure that you do join us on that webinar, and we'll be sending out dates and information for that. It'll be, I think right now it's planned for October, end of October.
Thank you. And Leanne put the link to the exceptional risk instructions and web form in the chat box for those of you looking for that. Will there be harvest extension or harvest for extension? No plans for that at this time. And the Harvest 2 report, when will the Harvest 2 report come out?
Well, that's been released for a while
Yeah.
now.
And then repeat the information about the frailty. Jenny couldn't hear.
Okay, I moved my mic up closer to my mouth, so maybe that's better. Sorry. We're meeting with STS and STS surgeon leadership are meeting with the state collaborative later this week, who the state collaborative has implemented frailty within their state and frailty data collection. So we're meeting with them to get some insight into how it's gone for them, any hurdles or obstacles that they may have had, or the reception with the sites within that state collaborative. And then we'll take that back through the STS surgeon and other leadership to discuss on path forward for potentially implementing frailty in the future.
Let's see, I can't get funds for Hot Topics. Will I lose out on important changes? No, you will not. You will not lose out on any important changes. We'll be updating all changes on future webinars.
Yeah, I apologize. I didn't want it to come across as though you wouldn't be getting the information if you're not able to join Hot Topics or not able to join AQO. We will have additional resources available. We had additional resources available at AQO and for the Hot Topics webinar. We'll have our surgeon speakers on, and questions and answers Q&A will be had. So it's a different type of platform, and it's just a different environment, but anything that affects the database as a whole will be absolutely pushed out to everybody, either through discussion on one of our regularly scheduled webinars or via email.
All right. Well, we are at 4:08 Eastern Time, so we're a little bit over. I don't see any more new questions. So I guess we will wrap it up for today. Thank you for joining, everyone.